So, welcome to our webinar on empowering participants to maximize their WIC benefits. We record all our live webinar and store them on demand for folks to view later um, if they couldn't make the live recording. All the resources we share throughout today's webinar, including a copy of the PowerPoint slide, will be made available with the recorded version on the on-demand webinar page of the New York State WIC Resource Hub in a few business days. Just a few reminder of our policy. You must register in order to attend a webinar. If you did not register through the Resource Hub, you will not have access to the evaluation and certificate. New York State DOH policy is that anyone who missed 15 minutes of a webinar will be removed and asked to view the recording another time. The webinar Zoom door will close 15 minutes after the start time today, and no one will be permitted in after that time. And we also want to acknowledge that at CAI, we support breastfeeding. If you are nursing and need to step away to pump, please chat the producer to make them aware. Policy is waived for those who are nursing. So it's important that you inform the producer or us that you are taking a break to pump so we can ensure you are allowed back into today's training. Again, good morning. My name is Sarisha Florman. I am a maternal infant health trainer, technical assistant, and breastfeeding specialist here at CAI, where I've been involved in several different maternal and infant health projects, of course, including WIC. And prior to CAI, I've been at CAI for almost about 4 years now. And prior to CAI, I work at two different Merrill WIC local agencies, where as a qualified nutritionist for about 5 years. And I'm joined by my co-trainer, Deb Bonzo, who's going to introduce herself as well.
Good morning, everybody. I'm Deb Bonzo. I'm a registered dietitian. I've been with CAI about 2.5 years as a senior trainer. Prior to that, I spent 34 years in upstate New York at a local WIC agency, and it's so nice to be with all of you this morning. I'm just going to have Kat Smith introduce herself. She's our wonderful producer today.
Good morning, everyone. My name is Kat, and I will be here to assist with any technical assistance that you might need. So if you lose audio or video, feel free to private message me in the chat. And I hope everyone has fun.
Thank you, Kat. And also, for those of you that are new to CAI or haven't heard about CAI, CAI is a nonprofit organization with over 40 years experience working at local, state, national, and international levels to help organizations improve healthcare and social services for historically marginalized communities. We do this by providing high quality education, training, research, and technical assistance services to organizations serving diverse communities. Some of our projects include sexual and reproductive health, maternal and child health, sexual violence prevention, HIV and STI, substance use, mental health, and tobacco use, to give concrete examples of the scope and range of our work. And of course, we are currently contracted as the New York State WIC Training Center. CAI's mission is to use the transformative power of education and research to foster a more aware, healthy, compassionate, and equitable world. At CAI, we believe WIC has the power to change lives. And also, thank you for continuing to add in where you're joining us from. We really welcome that. So this training was developed through a collaborative relationship with New York State Department of Health WIC program and Chickatelli Associates. Funding for this training provided by the USDA. On the slide, we have the contact information for both New York State DOH and CAI. Again, we will be providing you with a copy of today's PowerPoint on the resource hub, so no need to worry about copying this information down. Please note that immediately following the policy section of each policy in the WIC program manual is the regulations section, which either includes the direct links for reference or lists to complete regulation. The food and nutrition service provides assistance to state agencies and evaluates all levels of program operations to ensure that the goals of the program are achieved in the most effective and efficient manner possible. And I just want to say that as speakers for this webinar today, we have no disclosures to share. So let's go ahead and get started with our goal for this training today, which is to equip WIC staff with the tools and strategies necessary to help participants maximize their WIC benefits. And we are going to achieve that goal with the following learning objective. Identify several strategies to strengthen the redemption of WIC benefits. Ensure appropriate substitutions for WIC food package are provided. Understand the importance of maximizing WIC benefits. Also, explore practical tips and resources to maximize the consumption of WIC foods. Describe effective strategies to support the WIC shopping experience. So, with that said, we're going to go ahead and get started with our first activity. We are excited to really spend the next 90 minutes focusing on how we can better support our participant in making the most of their WIC benefits. To get us grounded in thinking about our goal today, we want to start with a quick interactive activity. For this activity, we want to create a word cloud by using a website called Menti and answering the question that you see on the slide here. What does it mean to you when we say empowering your participant to maximize their WIC benefits? So, Kat has dropped the QR code in the chat, and we'll also drop the website and the code for you to join if you can't scan the QR code. So once you use the QR code, you can use your phone, camera, or the QR or scan the QR code with a tablet. This will redirect you to the Menti page. You can also join by using the website and the code, like I mentioned, and Kat added that to the chat. Once you enter your response, it will start accumulating these words on the screen. So we're trying to create this wonderful word cloud when we ask that question. Again, submit all your answers, and we already start to see all these amazing answers coming in. So we see recipes, encouragement, using all benefits, giving knowledge, educating, access to resources, power to choose. Again, full redemption for participants, efficiency of redemption, healthy options, comfortability. We're seeing all these amazing words. What else can we think about? Nutrients, benefits, shopping with confidence is one thing that people are saying. Enlightenment, love that. I'm seeing some more in the chat. Healthy lifestyle, guidance, giving the participant choice, get all, if not most, full resource usage, access to resources. These are all amazing. So this is great. This is a really great way for us to really visually capture the ideas, the values, and hopes we're bringing into this session today. And it really helps frame our shared purpose when it comes to providing participants with their food package. These are all amazing words. It really speaks to the heart of what WIC is about, which is support, access, empowerment, and community. So keep these ideas in mind as we move through today's session. Everything we cover is in the service of that goal, right? Empowering participants to fully use and value the WIC food package, which is our next section that Deb is going to guide us through.
I loved all those inspiring words that appeared on that word cloud. That was great. So next, we're going to look at the value of the WIC food package. And to get us started, we're going to have some poll questions. So I'm going to ask Kat to launch the first poll and give you some time to answer it. Ultra high temperature milk may be substituted for participants lacking refrigerated food storage. And this is a true or false. This is great. And the correct answer is true. And 80% of you had that correct answer. So the correct answer for poll number 1 is true. We have another poll. The food package must be tailored to either include peanut butter or beans. And is this true or false? 61% of you were correct. For this poll, the correct answer is false. And we're going to move on to poll number 3. If a doctor prescribes Pediasure for a 2-year-old child, can you still issue other dairy products like milk, cheese, and yogurt? And the correct answer for this poll statement is true, and 96% of you answered true. We have one more poll. The amount of food issued is standard and is not tailored based on assessment and needs of the participant. Is this true or false? Great. In this poll, correct answer is false. Food packages are tailored for individuals. All right, let's continue our look at the value of the WIC food package. The WIC food package provides supplemental food designed to address specific nutritional needs of eligible individuals who are either pregnant, breastfeeding, non-breastfeeding postpartum, or children up to the age of 5. The goal is to provide essential nutrients for growth and development and overall health during pregnancy, infancy, and early childhood. Teresa, you can advance the slides and you can go on to the next one. That's great. We just wanted to highlight some of the key nutrients provided by the WIC food package. So protein is found in our milk, eggs, peanut butter, beans, and tofu. Calcium and vitamin D is in milk, cheese, and yogurt. Iron in the WIC cereals, beans, the fortified infant formula. Vitamin A is in sweet potato or in fruits and vegetables such as sweet potatoes, carrots, mangoes, cantaloupe. And then for vitamin C, it also is in fruits and vegetables such as the red peppers and strawberries, folic acid in green leafy vegetables, orange juice, fortified cereals, and whole grains. Fiber is in whole grains, fruits, beans, and cereal. And then choline is found in eggs and milk. The estimated monthly value of the WIC food package for children in New York State is typically around $73. Participants can buy and try new foods without spending their own money. The WIC food packages assist family in saving money that can be utilized for other purchases. The New York State WIC food package provides monthly cash benefits to purchase fresh, frozen, or canned fruits and vegetables. $26 are for our children participants, $47 for pregnant and postpartum participants, and then $52 for our fully and partially breastfeeding participants. I don't think we can highlight that enough. As WIC staff, you play a powerful role in helping families maximizing their benefits. When we guide participants to understand and use their WIC food package fully, you're not only supporting healthy habits, but you're helping them stretch the budget and provide them with the other essential needs. Every item in the food package has value nutritionally and financially. When participants don't fully use their food package, they are missing out on potential savings that could be used for other necessities. Let's encourage and motivate families to take advantage of all that WIC offers. WIC staff should make sure the participant food package works best for them and that they can redeem and use everything on their WIC food package. WIC staff should be the expert in the food package and understand allowable substitutions. Let's spend some time talking about some allowable WIC food package substitutions. Substitutions involve replacing one or more items on the WIC food package with alternate items due to food allergies, intolerance or medical conditions, living conditions, religious reasons, personal or cultural preferences. And I want to note the medical documentation may be required, especially when it involves a special formula or WIC nutritionals. Let's go over some possible substitution. Let's start with if someone has lactose intolerant. You could substitute regular milk for soy beverage or lactose-free milk. If adult or a child has a milk allergy, you could substitute soy beverages. If somebody has lack refrigeration, you can substitute ultra high milk can be substituted for the fluid milk if refrigeration is not available. If someone has unsafe water or potentially homeless, juice boxes can be substituted for bottles of juice. And if someone wants to try tofu, we can replace some of the milk with tofu participants who are interested in trying tofu. These are just some examples of options that WIC staff can offer when tailoring the food package. But remember, the participant has many more options to choose from while shopping. Note that the information can be found in WIC Policy 1250, WIC Food Package, and Tailoring Policy and Policy Supplement. The New York State WIC approved product list contains over 22,000 items, giving participants a wide range of choices tailored for their preferences when shopping. WIC staff are well equipped to help participants navigate the variety of available options from different flavors to specific food products. Examples of the choices that participants can make while shopping include they can choose from peanut butter or canned or dried beans. That choice is made at the store. They have options for whole grains, including whole wheat bread, pasta, brown rice, or tortillas. And the WIC approved list, fruits and vegetables can be purchased either as fresh, frozen, or canned forms. This flexibility allows participants to select items that best suit their taste and nutritional needs. Sometimes participants may not realize or forget about all the different options they have while shopping, especially if they're used to purchasing the same WIC foods each month. This is why your knowledge is so important when assisting participants in maximizing their benefits. I'm going to turn it over to Teresa. We're going to look at being participant-centered.
Thank you so much, Deb. So let's take a moment to hear from you. How are you currently preparing your participant for their WIC shopping experience? Go ahead and add your answers in the chat. Think about what you do to set your participant up for success when they're shopping. Whether they're reviewing their food package or showing them how to use, there you go, discussing the WIC2Go app, Kelly. Great. What else do you folks do? So you discussed the WIC to Go app with the UPC scanner, provide the shopping list, um, prov- thoroughly reviewing the allowable food choices in every food category, encouraging the participant to watch the eWIC shopping video, asking if they have any question about using their benefits, so making sure they understand, right? Show them the app on your own cell phone and show them pictures. Ask as Sending shopping lists in the mail and telling them to go through it and make a list before heading to the store, explaining the WIC to Go app. So a lot of folks are explaining the WIC to Go app for the participant and going over the shopping list and talking about the available substitution when they're issuing the food package. So helping also, I'm also seeing reviewing their choices and emailing them the a welcome packet that reviews how to use WIC. Well, let's see, what else do we have here? Showing them the acceptable food list for WIC, encourage them to ask the respective food market one is using WIC benefits and if they can verify which item or WIC qualified. I know some food, usually some food store have WIC food displayed under certain foods and on the store, right? These are all amazing answers. We know that shopping with WIC can sometimes feel overwhelming, especially for new participant or those navigating those food substitution. So thank you for sharing. This is such a great reminder that even small steps can really make a big difference in helping participant feel more confident and empower them at the store. Great. Thank you so much for chiming in. And let's keep the conversation going. How do you help participants figure out which foods are WIC approved? And some of you have already mentioned how you're giving them, you're sending them on the to watch the eWIC video and some other things. So what else are you doing to help them understand, having them understand the nutrients found in the WIC foods? Great. The WIC scanner. So Jennifer's also adding, after a month of their first benefits, I call them for a survey, and at the end, or if I ask if they have any questions, one question is to see if they have had issues and what those are so I can offer them help. That's amazing. Again, we're saying show them how to use the scan UPC function, explaining the tap on picture and to see what is available for them. So on the WIC to Go app, right, you could tap on the picture so they can read the list of foods that's available. Great. These are all amazing. Again, this is crucial in setting participant up for success when they're shopping. Really understanding what's eligible can reduce frustration at checkout and build that confidence in using their benefits. These strategies are so helpful. I'm also seeing how each food group is specific to that group of food with examples. Love that. Showing them photos of WIC approved items and name brands instead of just saying bread, rice, pasta, tortilla, right? Sometimes we have those wrappers at home or those empty cans. We could just shake them up, clean it, and have them available where we could show them how to scan. So these strategies are really great. And it's clear that when participants feel supported and informed, they're more likely to use their full benefits. So let's take a moment to really reflect on what participants are telling us about their shopping experience. In a recent survey, we found that about 15% of respondents said they had trouble identifying which foods are allowed by WIC. That tells us that there's still work to do in making the shopping process clearer and more intuitive for our participants. Even more striking, about 74% reported challenges overall. from locating WIC items in the stores to dealing with out of stock products. That's a huge portion of participants who are running into barriers, right? And this really reinforces how important it is for us to take a participant centered approach, anticipating these barriers and providing tools and tips to help participants navigate them with confidence. And we'll talk about some practical ways you can support participants through these common challenges in a while. Courtney is asking us, is this nationwide or statewide? This is statewide data, Courtney, that we got from DOH. So also, according to the recent local agency staff survey, WIC staff have reported that participants struggled with identifying which food categories are included in their food package, recognizing WIC approved products, and determining WIC approved item size. So WIC staff really play a crucial role in enhancing the shopping experience by equipping participants with the knowledge and tools to understand their food package and options before visiting the store, making it easier to find the foods included and shop more efficiently. This really aligns with with everything that you're saying, right? Um, Again, the survey shared that participants often struggle with understanding their food package, identifying WIC foods, and really figuring out the correct item size. And these are really real challenges, and they can create a lot of confusion at the store, especially for new or overwhelmed participants. But there is good news, right? You, as WIC staff, you are in a key position to really improve their experience when it comes to shopping with the food package. By offering clear, simple guidance and tools before participants even set foot in the store, you're helping them shop with confidence. It's not just about telling people what's in the food package, it's about helping them understand it, use it, and empowered by it as well. Jen is adding, sometimes the vendors change their products that are approved for WIC. We're also going to talk about that soon, Jen. Thank you for bringing that up. So, how do you usually address any kind of cultural or dietary preference when assisting participant in using the WIC benefits? Go ahead and add that in the chat. Most participants have concerns about redeeming the fresh fruits and vegetable. So how do you address cultural and dietary preferences when assisting participant in using their WIC benefits? I'm saying Jen is adding asking open-ended question. What else? You let them know of the available substitutions, giving them the options as that are applicable, asking if they follow a diet or restrict food. So again, asking those open-ended questions, really getting the participant to tell their story and letting you know what they usually eat. Tell me what you eat in a day, right? So you get to hear a little bit more about how this individual will eat. Tell them to talk with the nutritionist about this. Absolutely. Point out that a lot of the approved foods are multicultural and approved substitutions. Ask about specific ingredients used in their culture and how they can approve substitution. Love that. Ask about ask for brand preferences and cross-reference with VMA site to check if preferred foods are available to buy. Reviewing what is allowed and if it's not highlighting how using the benefits they can use can free up money to purchase that what's not approved. Reviewing what is used. That's what you meant, Michelle. Thank you. Great. These are all great examples of how you can meet people where they are and make WIC feel more relevant and respectful for their individual needs, right? Um, this is such important part of being participant centered, whether it's suggesting substitution, highlighting culturally familiar WIC foods, or just taking the time to listen to what matters most for our participants. So let's talk about feedback. We know not every shopping experience goes smoothly, right? Based on the survey response and what we hear sometimes from our participants. So when participants share concerns or frustration about using their WIC benefits at the store, how do you usually respond? Go ahead and share some strategies in the chat. Ask them what it is that I can do to help. Love that. Like, we're here to support you. Validate their experience and offer feedback. Being apologetic and trying to educate about WIC items. Try to see their recipe from the shopping trip. Yes. Figuring out what the issue is, right? How can I help you? Just listening to their concerns. Sometimes they need that listening ear. Probe further to see what's happening to better understand. Let them know you're here to help. Reach out to vendor management. Ask questions and offer to show them pictures on what they are buying. Share different places, locations that are available for them to shop for their foods. Ask for specifics like stores, items involved, validating them, and figuring out how to work out the issues with WIC vendor or with To Go app. Food is not available to them, tell them to speak with the store manager or to try different stores. Again, we're seeing vendor management being involved. Whenever they mention about having trouble using their cards, I ask to if they can come to the office to have the cards checked out. Love that. Again, letting them know about other vendors. So this is all amazing, right? I really love all these great ideas that are still coming in. Asking questions to identify the issue related to their bad experience. Absolutely. So folks are all on par with everything we feel, right? Listening with empathy, validating their experience, and helping them problem solve are all powerful ways to really turn a tough moment into a supportive one. Like Deb said earlier, we have to understand the value of our food package in order to sell it, right? If we agree with the participant when they say something about it, then we are doing a disservice to the amazing program that we have. One powerful way to support participant is by taking a moment to review their redemption history. So this screen really shows what they've actually used from their benefits over the past 3 months. Instead of just saying any changes to your food package, which can be too broad, right? We can use this info to really have a more focused, supportive conversation with our participant. So, for example, if you see a participant hasn't redeemed a certain item for a couple of months, that opens up the door to ask during a nutrition education appointment. I noticed you haven't used your cereal benefits. Would it be helpful to talk through some different options or substitutions? This small change, this small shift can really help you uncover barriers, offer practical tips, and suggest allowable substitution that better match their preference or need. And when participants know you're paying attention and ready to help, they're more likely to trust the process and feel confident navigating the store. I also want to acknowledge one more message in the chat. Educate them of all the vendor available to them. Encourage them to check all the stores available in the WIC to Go app. Thank you so much, Maximina, sorry. So again, getting back to our webinar here, this screenshot is from the redemption history screen in NIWIC. Don't ask us how we got it, but we got it. This screenshot really illustrates the participant is not redeeming beans, peanut butter, cereal, milk, whole grains, and yogurt. This provides the nutritionist with a starting point to explore the participant's specific needs and challenges. The nutritionist can offer recipe ideas and suggest substitution if the participant doesn't know how to use those items. The nutritionist could also offer some troubleshooting tips, review approved foods, and share some shopping resources if the participants share any challenges while shopping. And this is more participant centered than asking if they want any changes to their food package. So there's we know how there's I've met participants where they had too much milk on their food package and they didn't know that WIC was offering canned milk as a substitution. So that was an option and it made the participants so happy. And this is how we really stay participant centered. It's also important to ask open-ended questions, like some of you were saying earlier, to get more information from your participant, to understand your participants' individualized needs. Some examples you can ask on this slide here. What was it like to use your WIC benefits at the store? How do you plan your shopping trips to ensure you fully utilize your WIC benefits? How are you using your WIC foods? What additional information or resources would help you better use your WIC benefits? So we have another poll for you all here. What open-ended question could you ask to someone who has not been redeeming their WIC benefits? Most folks said, how is your shopping experience with the eWIC card? And that is the correct answer. So it wouldn't be all the above because we know that any changes to your food package is a close-ended question and it's a simple yes or no response from the participant. That's not giving us enough. That's not giving us anything to move forward from, right? You didn't use your milk benefits last month. Don't you like milk? Right? That sounds a little judgmental. This can get the participant a little more defensive and again challenge us to really get to the real problem solving here. So again, the one open-ended question here is how is your shopping experience with the WIC card, right? The participant's going to say, oh, let me tell you, I went to the store. I was so embarrassed. I was this, I was that. This is really going to open up the participant to share how their shopping experience was. So thank you so much for participating in this poll. Oops. So to truly support participant is not just about knowing the WIC food package, it's about being a local expert as well, right? That means understanding what's available in your community stores. A lot of you were talking about that. What common barriers families face, and knowing all the flexible options participants have within their food package. So, for example, if a family isn't redeeming their whole grains because they can't find the right size bread, we can step in and say, did you know tortilla and pasta also count? That small piece of info can really make that big difference for that participant. Or maybe someone isn't using their peanut butter benefits because they already have too much at home. I'm tired of redeeming. I don't eat peanut butter every day, right? That's an opportunity to suggest substituting beans or lentil and even share a few easy recipes, right? Because beans or lentil are more shelf stable, and they can use it more often as well, depending on their culture. The more we know, the more we can personalize the experience, and the more likely participants are to use their benefits fully and confidently. As WIC staff, you are the go-to experts for participants when it comes to understanding their food package and options. So it's crucial to always have access to the most current WIC formulary, right? A great way to keep everyone up to date is to use staff meetings to share a recipe that features WIC foods. It's a fun and practical way to stay engaged with the food package and spark ideas for when folks are having conversation with the participants. You should also be familiar with how to access the WIC approved product list. This is a resource for staff, not participant, but it's essential for helping answer questions or troubleshoot when a participant is unsure about certain products. You can find this list online at nyswicvendors.com. While participants won't typically use this list directly, it's your tool to really ensure you're providing the most accurate and helpful guidance. You should also know what WIC products are available, right? Become familiar with which store is are in your area. Thank you so much, Kat, for dropping that website in the chat. Again, become familiar with which stores in your area stock key WIC items like whole grains, dairy alternative, and produce. A quick call or visit, even when you are shopping for your family or for your house, right, or for your place, to really check shelf availability. It can save participants frustration at checkout, right? Set up shopping tools for new participant if possible. We know that can be, let's say if the store is across the street from your office, offer a brief store walk to show where WIC foods are. This really helps to demystify the layout and builds that confidence again. Even a 10-minute tour can make a big difference for someone shopping with WIC for the first time. You can also collaborate with your vendor management agency. If a participant still can't find an item, reach out to your vendor management agency and to see if the store can order the item or identify another nearby retailer. Excuse me. So this partnership ensures participants get what they need and reinforce that you're their advocate, right? If you're hearing something a lot from your participants, we can't find this, we can't find this, we can find this is your time to take action and to help them out by calling your vendor manager. So when tailoring the food package based on assessment and need, use your professional judgment to adapt each food package. You have those professional skills. This is not a one size fits all. You want to consider a lot, right? You have to consider cooking and storage for the participant. Ask about access to stove, ovens, microwave, and refrigeration. If space is limited, suggest ready to eat or shelf stable options, right? Just because we have something at home does not mean the participant has it. So it's really important for us to be mindful of that and ask them what cooking things they have at home, even before we suggest certain recipes that require certain tools for them to cook them at home, right? We have to consider safe water for formula preparation. You want to confirm with participants that they have a reliable access to safe drinking water. If not, you have to discuss safe prep alternative, whether it's pre-sterilized formula or boiled or cooled water. You also want to consider formula prep competence from the participant, right? You have to assess is this participant comfortable and confident in measuring, mixing, and storing formula. This is really important because there are some participants that don't have the competence to do so. So offer a quick demo or visual guide if needed, and cover safe storage timelines as well for them. You also want to consider the shopping frequency. So clarify how many shopping visits they can make per month so they can plan grocery runs and avoid last minute scrambles, right? Avoid, oh, the month ended. I missed out on getting the rest of my benefits. Right, you want to help them plan out when it's best to go to the store. You want to consider the transportation and modalities of the participant. Discuss how participants get to the store. Do they take a public transit? Do they have a car? Is it a ride share? Do they have to walk to the store? And tailor suggestions based on what the participant is telling you, whether it's bulk buying or versus smaller, more frequent trips to the store. And of course, cultural adaptation, right? Explore cultural food preferences and offer recipe modification using WIC foods, like swapping in plantain, cassava, or regional greens to honor traditions and increase acceptance. Again, These strategies ensure participants feel informed, respected, and truly empowered to maximize their WIC benefits. And now I'm going to pass it back to Deb to talk about some tips for purchasing and utilizing the WIC food package.
Great. So we're going to go over some tips for purchasing and utilizing because we feel both are important. So if participants are buying the food and then not utilizing the food, it's not a benefit. So we really want to go over some of those tips with you.
So I'll put myself back on video.
So I want to remind you that you need to stay participant-centered when suggesting tips for utilizing WIC foods. And it's important to remember that participants have individual needs and concerns, and not all these tips will work for every participant. But here are some. So we really encourage you as the WIC staff to know your stores and know your community. WIC staff should have a good understanding and knowledge of their WIC community, the WIC vendors within their communities. You should know the stores and the WIC products that they carry. We had an idea that you should maybe identify a WIC staff member for this role. This would be best practice, not a requirement. You should help participants identify a trusted individual to help them shop. I want to just circle back. We feel that because the knowledge of both the stores and that huge product list can be overwhelming for agencies, if you designated one staff person to kind of be that lead, and they could share that updated information at a staff meeting, they could be the go-to person within your agency when there's questions about products or what stores we're carrying. That's just an idea. So we have some best practices when purchasing. Discuss the difference between shelf-stable foods versus perishable foods with participants. We encourage participants to buy produce when in season. Like July is berry month, so buy the berries in July, teach them how to freeze them. We also want participants to maximize both resources, encourage participants to maybe buy frozen or canned fruits with WIC benefits during farmer market season. So in order for participants to really take advantage of both the farmer market coupons and their WIC benefits, maybe suggest during the month that they're using the farmer market benefits to purchase frozen or canned fruits. Then if participants both receive SNAP and WIC, we should encourage them to avoid using SNAP benefits to purchase WIC-approved foods. We want to help them or educate them to use WIC benefits first. This is done by swiping their eWIC card first at checkout and then using their SNAP benefits for any un-WIC food items. This is really something that can't be stressed enough and should be reviewed frequently with participants. We want to encourage participants to be aware of their WIC benefits expiration dates. So do they know when their benefits are going to expire? They should plan to shop early and encourage them to have a plan, right? Have a plan of how they're going to shop, what WIC products they're going to be purchasing when, how they're going to utilize the WIC food products in their daily, weekly menus. We also recommend that you could ask staff to remind participants to ask customer service. If a store does not carry a certain item, that store may be able to order it for participants. And the best practice for utilizing WIC foods is reinforce the importance of the WIC benefits, help participants plan meals around WIC foods, stay up to date on changes to the WIC food package and substitutions. And then I want to ask you, what other tips do you share with participants? What other tips do you share with participants on how to maximize their use of benefits? Any ideas? And if it's not tips, is there any other things that you do within your agency to maximize participants redeeming their benefits? Oh, they can use coupons. Love that. Yep. Watch for sales, buy one, get one free. Yeah, like a shopper's slavers or a club card savings. Yeah. Oh, Daisy, what a great idea. Refer to WIC Health online for new recipes, buy foods in season. Don't wait to the last minute to redeem your benefits. I know, because things happen, right? And then they're not able to get to the store. Share new items that have been added to the APL to get what they need when they need it. Yes. Always verify the start and end date so that they can use everything and don't lose benefits. Right, because there's a value to those benefits. Offer visual handouts from the vendor site. Yep. Ensure that the pictures on the WIC to Go app are not the only food options. Yeah, right, because there's so many food options. Gina, if you would unmute yourself and share how you stay up to date in your agency of the new items that are added, I'd love to hear from you.
Sure, Deb.
Yeah.
We on the vendor management website, it's posted every week. So they put a nice little list together of all the changes that were made from the prior week. So it's pretty easy to identify like if there's any new items that are added. So yeah, just kind of checking that.
Yeah.
Maybe not weekly, but
idea.
regularly. Yeah.
Yeah. Does everybody in your agency do that, or do you have like a assigned staff member? Or
We don't have an assigned staff member. That's a good idea though.
yeah, I know agencies are so busy and it's very overwhelming, but I know that was a tool I often used and was really surprised by a new product that was added or a new flavor of X, Y, and Z. And it can be overwhelming and challenging. So that's great that you guys are doing that.
Good idea.
So thank you. I'm going to go back to the chat. I know a lot more. Somebody said cooking demonstration using food items. I think that's another fantastic idea if you're able to do that. Encourage participants to use only their eWIC card because some participants use the SNAP card. Yeah, and again, Alicia, just really encourage them if they're shopping and not everything they're purchasing is WIC approved, make sure that they're using that WIC card first. Watch videos. Sarah said sometimes buying in bulk and freezing leftover items. Yeah, strawberry and bananas are great items that freeze wonderful and keep to be used in smoothies or other recipes. I asked for substitution when there was something they didn't want. Yep. Can call us if they're confused. Yeah, these are all great. I'd love to hear, does anybody do any like grocery store tours with their participants also to help increase their shopping experience? Because I've heard of some other agencies doing like grocery store tours. So we've talked about it. Jennifer said we've talked about it, but not so far. We don't, but it's on my list. Yeah. Daisy goes to ShopRite. Yep. Go ahead.
Hi, Deb. We used to do that, but this year we changed gears and we're doing Shop with WIC Zoom instead, where people can log in and ask specific food item questions.
Yeah, Melissa, do you have any idea how many people are participating in those Zooms? I get
It
notifications of them.
fluctuates. I would say we average about 15 a month login. We do it once a month. We used to do the Shop with WIC once a month, and I would say that varied 1 to 3 families, but it was limited to one grocery store, and we're a very large agency, so we weren't able to get everybody. So that's why we changed the Zoom platform.
Wow, I love that idea. So they're able to log in and ask specific questions related to shopping.
Mhm.
Nice. Do you have any idea of what kind of questions you guys are getting asked?
It could be
sure
specifics like yogurt. You know, I've only sat in on like 3 of them, so more specific items and how to use. It's nice because you can share your screen, and the woman who hosts it, she can show on her app, how to find things, use the scanner, things like that.
Great, thank you. I love that idea. So, and especially for agencies that may, like Melissa was saying, that they're a large agency, many different stores are out there, they were carrying different items. This Zoom idea might be a great way to allow participants to have the opportunity to ask questions. We've all been at the grocery store, and we all know how frustrating shopping at a grocery store can be. And if you've ever shopped with toddlers, you know that that's even more of an experience. Any other last thoughts about tips you share with participants? This has been great. All right, I'm going to turn it over to Tarisha.
Thank you, Deb. This is all great convo. So we're gonna talk about some of the tools and resources that are available for you at your fingertips. Would love again for some of you to either unmute or chat in. What resources and tools do you use at your agency to prepare participants for the WIC shopping experience? Take a moment to chat in or unmute yourself. Deb and I do love to hear other voices.
So in my office, we put together like a board just of pictures just for certain families. Sometimes they're like, what's a peanut butter? And we can show them like what it looks like. And we do refer a lot of our families here locally because a lot of them are walkers. So they go to the Hannafords, and I like to explain that Hannafords, by the price tags of the items, they have like red circles, and inside it says WIC. So it's more of a visual for them to look at. And even if they don't understand English, it's still like a visual that they can look for.
Yeah, absolutely. I'm a big visual learner as well, so I would definitely appreciate seeing what certain items look like. Thank you so much for sharing that, Amber.
And
I'm
I
also
do have the app as well on my phone, so I like to open it up and be like, okay, if you click here, this is what this shows, and if you click here, this is what that shows. So it is really nice that way too.
yeah, great. So you give that kind of like that hands-on
Yeah. And
guidance.
it was nice because I'm on the program too, so I can I've personally gone to the store and I know what it's like. I was on with paper checks. I knew what a nightmare that was.
Yeah.
It's really nice.
We all still have nightmares from that, right?
Yeah.
So you kind of normalize how easy it can be to
Yeah.
shop because you've had that
And there are
personalized
people that,
experience.
come back and they're like, oh, I had paper checks, and, it was bad because people would, give us the looks at the store and be like, oh, she's got, 5 different transactions. And they're like, it is nice now that it's all on the card. And I'm like, it's like you're using a credit card or a
Mhm.
gift card and a credit card. Like
Absolutely.
people don't
Absolutely.
really know as much now.
Absolutely. Thank you so much.
Yeah.
I'm also seeing your peers are also agreeing with the WIC to Go app. The shopping video is being utilized a lot. You share recipes with WIC products. Alicia, tell me where do you get your recipes from? Where do you usually look up recipes to share with them?
On the wheat health, I saw the recipe with yogurt, milk, fruit, and a lot of mommy they left the yogurt because they don't have flavor. Sometimes that's what they told me, and I say no, but you can mix with the banana because you have also fruit and vegetable, and also with the cereal because you get the oatmeal or quaker, what we the Spanish say, avena,
Yeah, see.
so you can blend there, and that is delicious. Um, um, that's delicious. That prepare for my kids, and they
Yeah,
love.
high
And
protein
oh,
meals.
I want to tell. I want to do. And then when I call, how was the shopping? Oh yes, I found that we can get Quaker avena cereal. And I
Yes.
said, wow, with the beans also because I prepare something for my child. I put banana, yogurt, milk, and peanut butter. This
Mm-hmm.
is good shake in the morning for my kids. And I cherry and they say, oh, this is good information that I want to keep with the yogurt because sometimes they say, oh, I don't want to get the yogurt because I don't use my child doesn't like it.
Mm-hmm.
But when I
Absolutely.
cherry that's kind of shape that my kids love, and they have everything and the week benefit.
Yeah.
Yes,
Yeah, I
that's
love
what
that. I love that. Thank you so much for sharing. And I
okay.
love that I'm hearing a lot of personalized experience and how you're utilizing some of these recipes and referring it to the participants and letting them know this is delicious actually. I remember we used to I used to tell participants how putting the yogurt with the fruits overnight can really build that flavor into the yogurt. And don't worry, your kids will like it. So the same things I love how much people share and try the recipes before they refer them to participant. Again, going back to the chat, I'm seeing approved food list, personalized shopping list, printouts, videos, and explain the WIC card and let them know that they can call if they have any questions, even if they are at the store. I love that. Miranda's adding photos, shopping lists, the redemption handouts found in the vendor website in WIC to Go app as well. Vendor product list. We contact initial certification 2 to 3 weeks after their appointment to see if they have any question about their shopping experience. So it sounds like a lot of you are doing these follow-up kind of like interviews or surveys, just checking in with your participants to ensure that they're not having any issues. And it's nice because you can pull up the redemption shopping list and see what the participant hasn't used if they've been to the store, and you can ask them questions that way. I'm also seeing the WIC approved food shopping card. Michelle is adding, I look for WIC approved card to find products in the grocery store when I'm doing my own shopping. These items would include whole grain bread. I try to note the location of where the product is so I can direct participants to where the items are located. This is amazing. Thank you so much for sharing that. Again, while you're doing your own shopping, you could just take a quick look and see, I wonder, right? Even after I stopped working for WIC and I was working for CAI, I've had participants come up to me and ask me with the app to help them find. I'm like, I guess I still have that WIC invisible logo on top of my head to help people with food shopping. So it's amazing to know that we can still do something in the grocery store and look for certain items to really help participate. I'm also saying encourage them to look at recipes on WIC Health. Lovely. Again, these are all amazing resources that folks are sharing, and this is an amazing chance for us to learn from each other, right? Your tips might be exactly what another agency needs. And would love to know, how do you typically share that the information with your participants? Do you have a standard way to ensure your participants are have those resources and those tools? Is it just via video on the phone through teletask? I'm saying.
It's kind of standard procedure. We have like a checklist for new participants that our support staff have with reviewing the video, sending the link to the EWIC video when we're pre-screening. So we encourage them to watch the video before their first appointment. So if there's any questions or anything like that, they can ask. And then the support staff, when we pre-screen them, we put an alert that the video was sent. So then the support staff can follow up with that. So, but
That's
they do review it again if because some people may not have watched it, so they review
yeah.
it and then send it again.
Yeah, that's amazing. So I never thought of that, like sharing the video even before the first appointment. So that way participants are coming in with questions if they do have some. And also I like the idea of having some kind of like a checklist, a standardized way for your agency that everybody can follow and make sure we're all on the same page to make sure that there's no participants falling through the crack, right? Everybody is getting that same information right at the beginning. Thank you so much for sharing that. Again, I'm seeing we asked them if they prefer their things to be mailed or sent via text. WIC strong, phone, text, or email, over the phone and via email. Again, I'm seeing text bulletin board in the office, Facebook. So some folks are using social media as well to share. Maybe we're sharing the video, right? Can someone add the link to the video to the chat? So Miranda's asking for help. So if you could add the link to the video in the chat so she can utilize it. So this is why we're having this. Um, Holly is saying we create a user guide for new participant with information on how to use their EWIC card and the WIC to Go app that we provide either by mail or in person. We love that, Holly. How long did that take for you to create that user guide? That's what I want to ask you. And how often do you update that?
We basically it was just standard oh, can you guys hear me?
Yes, we
Oh,
can.
sorry, I just want to make sure.
Yeah.
Just standard things that we, usually talk to our participants about, and then we basically just at our staff meeting we kind of just talked about it, and we ended up making it into just a user guide that we thought would be a good idea to provide to our participants, and it we think it's been had good success. I think it people people don't have a lot of questions, but if they do, they call us or they ask us. Um, but I think it's been good success with it.
Lovely.
And
Thank you
it
so
and
much.
it didn't take long to create. Sorry, I didn't mean to interrupt
Yeah,
you.
no, that's fine. Thank you so much for sharing.
Yeah.
And Amber's asking in the chat if you could share this with us. I would like to see it.
hmm
So Holly's creating a standardized way for folks. Miranda's also adding we add stickers for new items to the WIC food cards and blackout items that are no longer accepted. And this shows how to change the language. Oh, this was a comment that Michelle had. Okay,
So
great.
That
Yes.
the video is actually on the vendor website under eWIC. If you scroll all the way down on the home page, it says eWIC and then it has eWIC card training. The form that I attached is actually how to advise participants on how to change the language of the video. So it can be, there's many different languages that you can utilize that training in. So it just tells you how to do it.
Amazing. Thank you so much for sharing that with all. All right, so so we're gonna continue. Let's do a quick review and look at all the tools and resources that are available to us. So far we've talked about NIWIC Redemption History Screen. And I wanted to know how many of you utilize the NIWIC Redemption History Screen? I see Michelle raise her hand. Great. Cecilia, raise your hand. Okay, great. Yes. Amazing. It's such an amazing tool that's right there, right? When you have a nutrition education appointment, it's so easy to quickly check to see what's being utilized in the food package. Thank you so much for sharing. So again, we talked about the WIC shopping list, WIC acceptable food card, which is available in 22 different languages, and it can be found in the WIC library or on the New York State Department of Health website as well. We talked about the WIC vendor website. Uh, you also have WIC Connect, and the app for that is WIC To Go. So folks can either log in on the website if they don't have a smartphone to download the app, things like that, right? We could talk to them about going to the library to do that and stuff. You also have WICWorks, right, which is an invaluable online platform that provides a wealth of tools and resources specifically designed to support WIC staff. It offers evidence-based nutrition education materials, best practices, policy guidance, and training resources that help WIC staff deliver high quality, culturally relevant care to WIC participants. So some example resources found on the WIC Works for staff to use with participants. There is a whole series called "What Do I Do with My," that gives tips and recipes for using various WIC foods. Um, There's Eye on Nutrition. It highlights the importance of food and nutrients in the WIC food package for WIC participants. And Kat is going to add those in the chat, those links in the chat for me. And WIC Meals of the Month is a resource for staff to provide WIC participant with recipes to help them get the most out of their food package. It inspires them to try new foods and encourage lifelong healthy eating as well. Thank you, Kat. We also have the Cornell University website. It has great information on farmers market nutrition program. It really offers a consumer's focus page that has resources for what produce is in season, selecting and storing fruits and vegetables. So it talks about all those different tips on how to do that, and monthly featured recipes that folks can also utilize. Again, we talked about the WIC library recipes. The WIC library contains over 150 recipes for folks, and also the WIC Watch bulletin board. Look out for that. Sometimes they post different things on there. Last but not least, right? We mentioned WIC Health. WIC staff should stay up to date on the lessons available in WIC Health. And on the slide here, we have some lessons currently available, which is using your WIC foods, maximizing the food dollars, and finding recipes that works for you. So I want to take a moment here as we're getting to the end of our webinar today and ask you all, what is that one thing that you're taking away from this webinar that you would like to start implementing at your agency? Maybe not right now, but in the near future, in helping your participant maximize their food benefits. What's one thing you're taking away to do that? To really empower your participants to maximize their food benefits. Okay, we're saying asking if they have any trouble at the grocery store. Right. Just asking that open-ended question can really open the door and you can really help your participant utilize their WIC food package because this is what we want, right? We want folks to utilize the food package. I'm saying monthly shopping trips, right? Helping them think through. Okay, you off what day of the week? Okay, that's when your benefits gonna expire the following week. Maybe you want to plan your shopping trips the week before in order for you to utilize all your food benefits and not lose out on anything. I'm saying look at meals of the month and send through teletasks with app appointment reminders. I love that. That what an amazing way to share with folks, right? And people, if they see a simple, easy recipe that they can utilize, they're gonna do it, right? Thank you. Sending the video when we pre-screen, and making a board with pictures of food like Amber. I love that. Amber, you you influence someone. I used to be the queen of making boards, so I'm a par with that, Miranda. We love that. And send us pictures. Michelle is adding designated WIC staff focus on the allowable foods, new foods, and deleted foods. Absolutely. Again, this is a really it's there's a lot of foods on the WIC food package, so it's hard to manage, and having someone that can do a quick little update during a staff meeting can be really helpful for the nutritionists to be aware of what's happening with the WIC food package. These small tasks can lead to like greater outcome, right? When we want to empower our participants to maximize the food package. Asking how their experience with the food package. Again, asking those open-ended questions to find out from our participant. Doing follow-up calls with our participants to ensure that, hey, is everything okay with the food package? How was your first trip, right? How was your first trip at the grocery store? Love it. Love it. Always reviewing their food package at each appointment. Yeah, right. This is not just for recertification appointments or if some, right? We don't want to wait until the person is like most food package changes that we do is usually formula, right? Not the regular food package. So it's really important for us to check in with our participant and find, hey, do you need any additional support? How can I help you? Encourage them to utilize WIC health recipes to maximize their benefits at home. Absolutely. If this is a participant that loves to cook and loves to try different recipes, you want to put them onto this amazing resource. Call to WIC if you have questions regarding your food benefits. Yes, we're here to support you. We're here to help you maximize your food package and utilize all of this. Nicole saying all of this. Nicole, we gotta start small. We gotta start small because this is not an easy task, right? It takes a lot to really keep track of all of this. We're not telling. We're here to provide you with all the amazing tools, tips, and resources, but you do want to start small. I want to put that out there. But thank you for sharing that. Mary's saying, I always ask if they are able to use their benefits without issues. Absolutely. And we hope you continue to do that, Mary. You are on the right track. And we want to continue to improve that. Again, checking that redemption page to ensure that they're utilizing the food package. Providing recipes and suggestions for the WIC approved foods that are not purchased as often. Absolutely. I love that, Deliza. Oh, this is so pretty, Amber. Thank you for sharing this picture. So, Miranda, you have you could download that picture and save it. That could be on your Pinterest board or something for how you would like your yours to look like. Users guide and follow-up calls, and do a survey about their WIC shopping experience, and we can plan on how to maximize their shopping experience. I love that. I love that. Deb and I, our hearts are full. This is a webinar that was very dear to us, and we're so happy to see all the amazing ideas that you are walking away with from this webinar. With that said, we want to thank you so much for joining us today. We do want to say CAI will offer an opportunity for learners to evaluate this continuing professional education activity, and will regularly use this important feedback to continually improve the activities materials offered. Please note that you are able to send feedback directly to the Commission on Dietetic Registration, CDR, by emailing qualitycpe@eatright.org.